yung itanong sa ating guest na yung gabi. No? Pwede nyo pong gawin yan sa pamamagitan ng ating mga text line tsaka hotline numbers sa 0977-631-0607 at 0949-570-8003. Yan po. So, meron din po tayong mga hotline numbers. Yan po ay 412-0288 at 997-7589. Tayo po ay live na yon, no? Streaming over our different media. No? Meron po tayong website na www.atrymedia.com. Tayo po ay live streaming dyan. At tayo rin po ay may mga accounts din po, no? Sa YouTube at HI Media din po ang ating YouTube source, no? At Facebook po sa facebook.com/HTryMedia. Tayo rin po ay nasa Twitter, no? So at Instagram. Ang aming pong handle ay @HTryMedia. So yan po, just search us po sa inyong mga platforms, no? At sa cable link din po, tayo po ay live na napapanood sa cable link channel 7, no? At sa DZRJ 810 sa inyong talapihitan. Yan po. So magandang gabi po sa inyong lahat at samahan niyo po kami ngayon sa isang oras sa ating diskusyon. Ang ating pong topic na yon, no, ay oral health. Yan. So this is my first time to guest a oral health expert, no? So siya po ay expert kasi po marami na po siyang napagdaanan, no? So we will interview him later, no? Pero hayaan niyo pong ipakilala ko po siya, no? Siya po ay past president ng Philippine Dental Association Muntinlupa Dental Chapter. Siya rin po ay nagturo sa mga institusyong pong ito, College of Dentistry ng Perpetual Health University sa Binyan, Laguna, at sa Adventist University of the Philippines. Yan po yan sa Santa Rosa. Siya rin po ay former professor at head ng periodontology, ng Mekelle University. Yan po ay sa Ethiopia, no? So medyo malayo po 'yon, ano? We will ask him about his experience in that work, no? Tsaka siya po ay 9 years na nagturo din at nagpractice sa King Saud University sa College of Dentistry ng Kingdom of Saudi Arabia. Yan. Tsaka po, siya po ay nagpractice din po sa Riyadh Rehabilitation Center. So, siya po ay marami nang napagdaanan. Ano? So, yan po. Ang ating pong topic na yon ay basic, no? Very basic, very practical. Oral health. Ng paano natin mapapangalagaan ang ating ngipin, no? Ang ating oral health, no? So yung pangkalahatan, no? Hindi lang ngipin pero pati gums na rin. Pag-uusapan din natin po 'yan kung ano yung tamang pagsipilyo, 'yan. Very practical instructions and take home for our audience and our listeners, no? So ipapakilala ko po sa inyo si Dr. Walter De Rosario. Siya po ay fellow ng Pierre Fauchard Academy at siya po ay may Masters on Health and Science Education. Ang dami po, Doc, ha? Thank you po. Thank you, Doc, for coming.
Sige okay, po, good evening, Dr. Jan, and I would like to say good evening sa lahat ng viewers and listeners sa Klinika On Air. It's nice to be here.
Ayan. Salamat po, Doc, for braving the traffic for us, no? Na yung gabi. Na yun. Sige po, let's start, Let's start the ball rolling, ika nga,
right,
sa ating diskusyon. Oral health education, no? So, when do we see a dentist, Doc? Kailan tayo kailangan magpunta sa isang dentista?
Okay, that is a very nice question for a start. Actually, pagkapanganak pa lang ng bata, kailangan na siyang ipasyal sa dentista.
Okay.
Unang-una para makita ang oral cavity, kung how clear it is, and and then pagka tinutubuan na ng ngipin, lalong-lalo na, para nang sa ganon magabayan natin yung kanilang mga magulang, lalo na yung mga nanay, kung paano nila lilinisin ang ngipin ng kanilang mga anak. Merong kasing style or way of cleaning an infant's teeth. No?
Okay.
Ito yung ihihiga mo siya sa lap mo. Kung ikaw mismo o kung nanay ang maglilinis, nakahiga siya sa lap, nakaharap yung bata sa
Nakaharap yung ulo.
nanay.
Okay,
Oo.
okay.
Pagkatapos, tsaka niya lilinisin ito.
Okay.
Ngayon, kung iba naman na maglilinis, it's the other way around. No? It's the other way around.
Aha, okay.
Alright. So, iyon. Pagkatapos, palagay ko mas maganda kung sasabihin natin na dapat lang na magpakonsulta ang individual, ang isang tao, ng at least every 6 months.
Ayun.
Now, ang mahirap kasi is usually ang dental disease ay wala kang mararamdaman. Asymptomatic. Unless otherwise, medyo grabe na ito.
Yun yung mga sumasakit.
Yun yung mga sumasakit
yung
na.
nagdudugo, may bleeding na tayo.
Correct, oo.
At saka tayo nagkapatingin.
That's right. Oh. Kasi yung
Bakit
ngipin,
kaya?
yung ngipin natin, Doc John, it has several layers, no?
Okay.
Since we know, alam natin na yung ngipin ay hardest calcified tissue in our body.
Mhm.
Like for example, yung sa mga forensics, no?
Oh yes, yun ang gamit nila.
Halos lahat beyond recognition na eh. Pero
Ano na.
pagdating sa ngipin, buo pa rin nakikilala nila ang isang individual, no? So the outer part of a tooth is called the enamel. So ito yung matigas talaga.
Okay.
Pagka nasira ito, then it exposes the dentin. Medyo mas malambot ito, but the dentin actually occupies the bulk, no, of a tooth. And mas madaling masira ito. Once na nasira na yung enamel, mas madali nang masira yung dentin.
Parang na-expose na siya.
Na-expose na.
No? Okay.
And then after the dentin comes the pulp. Ito yung this occupies the chamber na kung saan nandun ang nerve, blood vessels that supplies the nutrient of teeth. Okay. So nag-i-start yan actually pag-usapan natin yung kung paano nagpro-progress, no, ang pagkasira ng ngipin.
Okay. Paano nga ba, Doc?
Okay, usually it starts with a thin film of bacteria that adheres, no, to a tooth. Pagkatapos with the reaction of the saliva and the food, no, it becomes acidic. So it forms an acid. So itong acid na ito gradually dissolves the enamel.
Okay. Parang ano siya? Parang yung like for example yung muriatic acid
Correct.
na
Yeah, that's right.
konti-konting nauuka.
Nauuka
Yes.
niya, oo.
Okay.
So imagine na ang isang pinakamatigas na parte ng katawan kayang-kayang sirain ng asido na ito, no?
Okay.
So when it exposes the dentin, then it can rapidly lead to enlargement of the cavities, no? Magiging malalim na yung sira, magiging yung butas ng ngipin na nauuka niya na yung laman, yung dentin.
Okay.
And then later on, kung hindi pa rin pinagamot dahil nga minsan wala namang pain.
Mhm.
So the enamel will collapse. Alright? So mababasag na ito and later on it will expose the pulp. So pagka na-expose na yung pulp, eto na yung problema.
Yan na yung sumasakit.
Eto na, masakit na ito. In fact, pagka medyo malalim na siya na almost near the pulp na, yan, may sakit na yan.
Because of the nerve
Because of the nerve.
that's attached to the
Yeah,
pulp.
it's very near already.
Yun.
So pagka nag-expose na siya sa pulp, tapos nagkaroon na ng infection and then nagkakaroon na ng abscess formation.
Or nana.
Nana. Oo.
Okay.
So usually nagka-abscess formation dun sa pinaka root part ng ngipin. Okay? So, meron din namang makikita mo na may nabubutas dito sa labas.
Okay, sa gums, Doc?
Sa face mismo.
Sa face mismo?
Oo, dyan sa face mismo.
Wow.
Pagkatapos, dyan lumalabas ang nana.
Okay.
Oo. So, nangyayari yon. Fistula ang tawag doon. Nag-fistula na. No? So, para maiwasan natin yon, kailangan malaman natin kung paano natin may iwasan, kung anong gagawin natin para makaiwas tayo dyan.
Okay.
No? Siyempre, unang-una, kung paano natin pangangalagaan ng paglilinis ng ngipin.
Okay.
Lagi nating sinasabi na dapat magsipilyo
Pagkatapos kumain.
No?
So, pagkakain niyo po, Doc, talagang kailangan you have to brush your teeth kasi, siyempre, ang mga tao parang siguro once ka din na nagbabrush, pagka matutulog na lang, or pagkagising lang sa umaga. So,
Okay.
ano po talaga yung tama na...
You know, actually, Dr. Jan, sa akin kasi, no, sa practice ko, ako, masaya na ako pagka ang pasyente susunod sa akin na magsipilyo ng isang beses lang sa isang araw sa gabi bago matulog.
Sa gabi.
Oo.
If you have to brush
If you have to
once,
brush once, just brush once sa gabi, tapos concentrate on cleaning, really
doing a good
job on
cleaning
cleaning.
your tooth.
Yes, oo. Kasi sa gabi, pagka natutulog tayo, hindi tayo nagsasalita eh. Ang laway natin, okay, it has this buffering capacity or cleansing capacity.
Natural po yun, diba?
Natural yun, oh. Habang nagsasalita ka, nag-flow ang saliva mo. Kaya minsan, habang nagsasalita ka, meron kang nakukuhang konting, because of that, flow of the saliva.
Okay.
Now, pagka natutulog tayo sa gabi, stagnant ang saliva eh. So, alam naman natin na pagka ang tubig hindi nag-flow, medyo mas marami yan na magkakaroon ng lumot.
Yeah, so parang nakababad yung
That's right.
nakababad yung ngipin ninyo.
Nakababad lang yung doon eh.
Okay.
So, bacteria will have the chance to grow. Okay? So, in the morning, we just have to brush parang warso-warso just to freshen up your breath and everything. After you eat, you can rinse your mouth thoroughly and that's it. But of course, I'm not saying that eto sige pwede mong gawin to. Kaya lang this is also a case-to-case basis eh.
Okay.
If I'm saying this if I see that the patient is capable of maintaining the hygiene, doing a great job. Pero kung hindi, of course, siyempre, we have another way of saying, you have to brush after each meal, you have to do this and that, you know.
Yes.
Ganon.
So, ganun pala no? So, kailangan talaga, as much as possible, if you have one thing to do sa pagbabrush, do it in the evening. More than
Yes.
any time of the day. Kasi the whole day, your saliva is being clean, and
Yes.
you also drink water.
Yes.
Siguro that's also a factor, no?
Yeah.
I don't know,
Yeah, most especially sa mga bata, lalo na yung mga nagba-bottle feeding pa.
Ayun, because of the milk.
Yeah, because of the milk. Nagkakaroon kasi ng yung caries, yung mga bata, lalo na pagka ang ginagamit nilang pampatulog sa kanilang anak ay yung kanilang gatas, yung feeding bottle.
Yes, indeed.
So, pagka ayaw matulog, susubuan ng dede yan para makatulog.
Yeah,
And then after that, nakababad pa
wala
yun.
na, hindi na nililinis, hindi na
Nakababad pa yun.
So mali pala yun doon.
Oo, kasi the milk alone will stay on the surface of the teeth.
Yeah.
That can cause, of course, yung bacterial growth.
And actually, Doc, I think milk is also acidic.
That's right.
Diba? So,
That's
kaya nga
right,
hindi tayo nagpapaprescribe ng milk pagka nangangasim yung ating sikmura kasi
Correct.
lalong masistimulate
Tama
yung
yan.
acid. So, ganoon din in your
Oo.
oral cavity, no? So, kailangan talaga walang nakababad dyan na ano.
Oh, and actually mas ini-encourage nga namin na after na i-feed ng gatas sundan ng tubig.
Tubig.
Oo, para nang sa ganun ma-cleanse kahit papaano.
Siguro ka naman, pagkahabang tulog yung bata, kung ayaw nilang gisingin para i-swab yung bibig, pero pwede sigurong tubig nila.
Tubig, oo. After ng
A few
meal.
sips of water.
Oo. Tapos ang isa pang kadalasan na tanong diyan, Dok, paano nga ba talaga ang way on how to brush properly?
Okay.
Yun, marami kasing mga styles o maraming mga techniques on brushing. Right?
Yan.
So, yung sa akin kasi is iba. I have used this sa mga clients ko, and yung iba yung way on brushing na tinuturo ko.
Okay. Sige. Ano ba, Dok, yung tama? Sige, para malinawan ng ating mga
Actually,
audience.
hindi ko sasabihin na
Tama. Oh.
lahat
in your
sila
practice,
tama. Sa practice
yan.
ko, ang ginagawa ko is the parallel technique. Okay.
Parallel.
I use the brush almost parallel. I place it almost parallel sa ngipin. Okay.
So,
And then,
parallel.
Kung baga nakaganon siya. So imagine this is the single bristle. Ito yung ngipin, nakaganon siya.
Okay.
Yung bristle, papasok siya in between the gums and the teeth.
Parang nagwawalis.
Yan.
Sleeping.
Parang nasusungkit niya kung ano yung nandun sa... Kasi merong free gingival margin between the teeth and the gums.
So yung dalawang ngipin, merong space doon.
May space. Pero yung between yung ngipin mismo tsaka
And
yung
the
gums,
gum.
merong space yan eh.
Okay.
So yung space na yon, 1-2 millimeters is good. But 3 millimeters above, we consider it as a pocket already.
Okay.
So, yun yung hindi na natatamaan ng bristles ng brush.
Okay.
So, if you use the parallel technique, you just have to vibrate, the bristles a little, and then sweep it down. That is for the upper. But for the lower, vibrate and sweep it up.
Okay.
Ganun.
Sige, Doc, we have to cut you short because meron po tayong konting palatastas. Diyan lang po kayo, ha?
Okay.
We will still continue our discussion on
Surely.
oral health care. Sige po, diyan lang po kayo.
Manatiling nakatutok sa DZRJ 810 AM, 8 Try Media at 8 Try TV, Cable Link Channel 7. This is 8 Try TV.
Ang dami ng peke sa world. Pati ba naman puti mo? Peke din? Para totoong puti, mag-Myra Vita White Moisturizer. May vitamin E at natural plant extracts to help nourish skin for that healthy white glow. May double sunscreen na, non-sticky pa. Ito ang totoong healthy white glow. From Myra Vita White Moisturizer. Yan ang alagang holistic.
Trusted quality healthcare. Unilab yan.
Mantikang makapit, mag-dishwashing na sulit! The sulit!
Kalsebo, pati lansa. I love it. Sulit pa yan. Pagdas paste o doble pat. Ang dali ng hugasan. That's the way. The sulit. I found the one. That's the way. The sulit. I found the one.
Todo linis, presyong sulit, das!
Still happened here. One guy took them all out in like seconds.
He's still in there.
Who the hell are you?
The guy you didn't count on. Jack Creature from Major Turner.
Turner's been arrested.
My men were shot.
He's been set up.
I don't want them as bad as you. I want them more.
I want being followed. He's not feeling well. You might want to use this one.
Kapag lumindol at nasa loob ng isang gusali, gawin ang duck, cover, and hold. Habang lumilindol, yumuko
Ang
o
gabi.
umupo, magtago sa
Kasama pa rin po ninyo si Dr. John sa ating Friday edition at ang ating panauhin na yon ay ay walang iba kung hindi ang ating dentist na si Dr. Walter De Rosario. Ayan. So Doc, we were saying kanina po dun sa brushing, it has to be parallel.
Yeah.
Okay?
Pero usually yung mga tinuturo natin lalo na sa mga public schools,
Sa mga bata.
sa mga bata, para mas simple siya.
Okay.
Basta sinasabi natin, ang ngipin sa itaas, sipilyuhin pababa. At ang ngipin sa ibaba, sipilyuhin pataas. Para nang sa ganon, in between ng ngipin, nakakadaan ang bristles ng brush natin.
Dok, alam nyo, very common, I see people, how they brush, ganito yung nagmamadali. Tapos, talagang nanginginig yung kamay. Tapos, ginaganon, no? So, it's a jarring motion na talagang ganon,
Nanggigigil,
Nanggigigil, no? Is that a correct way? Ano ba ang parang di ko alam eh.
Ano yun mas nakakasama ito sa ngipin eh.
Okay.
Like any surface, pagka yun ay kinaskas mo, ito ay magkakaroon ng marka, no?
Yes.
Kasi na-abrade yung surface na yun. Kahit na metal pa, kaskasin mo ng kaskasin araw-araw, magkakaroon ng abrasion. What more kung yung ngipin? That's why yung sinasabi natin, Doc, ang toothbrush ba kailangan matigas?
Ayan.
Oo, ako the more yung bristles ay soft, the better.
Yan.
Kasi yung dumi ng ngipin natin, lalong-lalo na pagka ikaw naman ay maganda yung hygiene. Kahit na gaano kalambot ng bristles ng toothbrush mo, pagka naidaan mo yan sa surface ng ngipin, tiyak na matatanggal ang kung ano man ang nandyan na nakadikit.
Okay.
Kaya lang, nasanay lang siguro ang mga tao na talagang madiin mag-brush. Kaya pagka tiningnan namin, usually sa oral exam, ang daming mga tao na merong mga abrasions dun sa neck ng ngipin.
Kasi dun yung parang natatrauma.
Dahil yun ang yun ang tinatamaan. And this is also one of the reason why I ask my clients to brush at least once lang sa isang araw.
Okay.
But do it thoroughly sa gabi bago matulog, just to avoid further trauma or abrasion.
Okay. Doc, how about the time? No, gaano katagal dapat? Kasi parang 1 2 3, 1 2 3, that's it. Bumog na.
Yeah,
Gano'n ang
that's
mga
right.
tao.
Oo.
Ano po yung tamang oras na binibigay sa pag-brush ng ngipin, saka gaano kadami tubig ang dapat na niyo hanggang
Okay.
mawala yung lasa ng toothpaste? Ano po? Sige.
Okay. So, sabi nga nila yung paghuhugas daw ng kamay, no? You have to sing
Happy birthday twice.
Oo. Ako sa akin pwede na rin 'yun eh. Kaya lang ang ano ko kasi you have to be systematic on brushing your teeth.
Okay.
Kasi pagka nag-start ka sa kaliwa, pumupunta ka kagad sa kanan kahit hindi pa tapos yung lahat ng kaliwa. So dapat kung mag-i-start ka sa kaliwa, sipilyuhin ng mabuti hanggang pakanan.
Okay.
Tapos you go back sa likod hanggang
Ayun.
pakaliwa uli, and then you go down, then hanggang pakanan uli, and then you go likod hanggang sa kabila uli.
Basta meron kayong system.
Dapat may system.
Up and down.
Yes, dapat may system para wala kang nai-skip.
Okay.
Para wala kang nai-skip na area dun sa ngipin mo, dun sa bibig. And normally they also ask if like ano po ba ang magandang toothpaste?
Ayun. Sige, very important. Ano yung magandang toothpaste, Doc? Sige,
Okay,
explain the toothpaste.
Doc, I'm going to tell you this. Yung mga toothpaste po na ginagamit natin, meron niyang color coding yan kasi. Color coded yan.
Okay.
Dun sa base ng toothpaste, meron niyang isang hibla ng maliit na kulay. Okay?
Pansinin nyo po yun, ha?
Yan,
Doon sa
oo.
may dulo ng hindi sa takip, kung hindi doon sa kabilang end.
Oo,
ng
doon
takip.
sa puwitan.
Sa may
kumbaga.
puwitan,
Sa may
yeah.
puwitan.
Okay.
Okay, pagka nakita nyo na merong black na isang strand na kulay dyan,
Mhm.
ang ibig sabihin na yung toothpaste na ginagamit nyo ay pure chemical ang composition.
Okay.
Okay? Tapos pagka ito naman ay red, this is a combination of natural and chemical.
Okay.
Okay, ang composition niya. But if you see blue mark there, ang ibig sabihin, ito ay may natural at may medisina. Merong medicine.
Okay.
But if you see a green mark, then ang ibig pong sabihin ito ay pure natural ang composition ng inyong ginagamit na toothpaste.
Okay. So, depende po sa pangangailangan
Depende sa pangangailangan.
ng tao. Yun ang
That's
ano.
right.
So, tandaan niyo po yun, ha? So, if it's black, it's chemical.
It's chemical.
No? So, tandaan niyo, black, chemical. Ano pa? Yung red,
Yung red, it's natural with.
natural
Chemical
with
composition.
chemical. No?
Yeah.
So, is it more natural or more chemical? Or,
I think I don't exactly know. I don't know
Pero-
exactly kung ano yung balance ng composition niya.
pero it has both.
But it has both. But
Okay.
it has both.
Tapos yung blue po ay natural,
Natural and medicine.
and a medicine.
Yeah.
So, blue, parang pill, blue pill. So,
Ah.
medicine. Tapos yung green,
Yung green ay all natural yan.
so, think green, grass, organic, all like
That's
that,
right.
natural. So, yun pala yun. I have never thought about that. Meron palang gano'n. And this is true for all toothpaste or meron lang toothpaste na meron yan?
Dapat meron siyang mark na ganon.
So, talagang
I
ano
think
yan?
this is
Mandated
international.
yan ng ano.
Yes, oo.
ng mga
Kasi dun
manufacturer.
nalalaman kung ano ang composition talaga nung paste.
Okay. So, ngayon po, no, check your toothpaste kung anong ginagamit niyo. I think maraming mag-switch na, no, kung ano hindi nila alam na ano, 'di ba? And I think the more preservative, the more flavor, I think is
That's right. Sabi nga nung iba, ano ba talaga yung magandang gamitin? No?
yes.
Or how about kung walang pera,
O yan, paano
tao.
yan, Doc? Yes,
So,
kung walang pera pang-bill. Actually, toothpaste can be expensive, Doc. Ha?
That's right. Kaya hindi naman ako talaga nagpre-prescribe ng sa mga pasyente na gumamit ng toothpaste.
Doc, parang kailang ang dentist na nakita ko na hindi nag-prescribe ng toothpaste, ha? Okay, sige, bakit po? Bakit?
I have a reason for that.
Okay, please. Explain.
Normally, ang mga toothpaste na available now in the market, ang sasarap ng lasa niyan.
Yes.
Diba? Iba't iba ang lumalabas ngayon, iba't ibang flavor. Ang lumalabas ngayon, kahit na yung mga flavor na pang ice cream, meron na sila.
Merong mga bubble.
Yeah, that's right.
May strawberry.
That's right.
May peppermint.
And if you're going to use this, usually, ang mga tao, pagka naglagay ng toothpaste, kung gaano kahaba yung toothbrush, yung bristles ng brush nila, ganun din kahaba yung paste na
Tama.
nilalagay nila.
Tama ba ho yun?
O,
What is the correct amount?
okay, sa mamaya, no? Mamaya sabihin ko
sige,
sa'yo.
sige.
Pagkatapos, minsan pagka isusubo na nila yon, no, ilalagay nila sa bibig nila, hinahabol pa nila sa
Nahuhulog.
sa lababo dahil nahuhulog siya, di ba?
Correct, nangyayari na po sa akin.
Okay.
Personally, yan.
Okay,
Tapos
so,
ginaganon ko sa
oo,
lababo.
tapos
Kasi sayang
dapat wag nang kunin kasi madumi yung lababo
Correct,
di ba?
correct.
So what we can do is put a little amount of paste. Pagkatapos medyo taktakin mo ng konti na ganun para sumuot yung paste dun sa brush.
Ayun.
Para kahit na ibaliktad mo yung
Hindi siya
toothbrush,
mahuhulog.
Hindi siya mahuhulog kasi nandun na siya sa loob ng bristles.
Correct.
Okay? And what we really recommend if you're going to use a toothpaste actually is just pea size.
Actually, yun ang aking naririnig pea size. So,
Pea size lang will do the trick.
The green peas, ganun lang ka.
Ganun lang, ganun lang.
Ganun lang kaliit.
Now, why am I not recommending toothpaste sometimes or most of the time? Because it mislead patients on oral hygiene. Usually, pagka nag-brush at maganda ang lasa, no?
Parang nasahan niyo yung toothpaste. Isa, kinakain pa niya yung
Oh,
toothpaste.
that's right. Ilang strokes pa lang, and then you feel good, you feel fresh already,
And they stop.
and they stop, and they rinse. But they didn't realize na hindi pa na lilinis lahat ng surfaces ng ngipin nila. So what I recommend is, don't use paste, use just plain brush, wet the bristles.
Okay.
Sometimes I ask them to wet it with warm water
Okay.
para nang sa ganon medyo lumambot ng konti yung bristles.
Okay.
And then brush brush thoroughly.
Mm-hmm.
And then after that, then they can taste what is there that they should remove. Okay? Normally,
Masasahan na nila yan.
oo, normally yung mga dapat mong tanggalin dyan, hindi ka aya-aya ang lasa niyan eh. And meron pang isang trick dyan, Dr. Jan, kung gusto mong malaman kung meron kang bacteria or hindi maganda yung condition ng
Okay.
mouth mo, dilaan mo yung kamay mo.
Dilaan mo yung kamay mo.
Dilaan mo
Okay.
yung kamay mo na ganyan. Pagkatapos patuyuin mo lang siya or i-rub mo na ganon. And then you try to smell.
Okay, dapat.
Dapat walang hindi magandang amoy.
Wala hindi magandang amoy.
Oo.
That means kulang pa or mali yung pagkakabrush?
Hindi, this is not after brushing. This is just like usual.
Yeah.
Kunyari, usual. So, pagka nirab mo na gano'n, tapos inamoy mo.
Kailangan walang amoy.
Dapat walang amoy. Dapat hindi masama yung amoy.
Okay, sige. Tapos, after that po, ano pa yung mga kailangan natin gawin? I think you mentioned, no? We were talking about yung mga tongue scraper.
Oh, yeah. This is very important. Kasi yung surface ng tongue natin, it's like, we call it villi. No?
Yan.
Mga parang towel siya eh. Parang towel.
Ang tawag dyan papillae, no? Yung
Yan, may mga
ganun.
papillae. Ngayon, pagka kumain tayo, usually yung mga nadurog na pagkain, yung mga almost na liquefy na sumusuot yan dyan eh. And then this will encourage bacterial growth. Now, meron tayong available sa market na mga tongue scrapers,
Okay.
mga tongue cleaners.
Mhm.
We have to do this also. Kasi pagka in-scrape mo yung tongue mo na ganun, makikita mo na merong parang malapot na at saka medyo maputi na makukuha ka.
Exactly.
And then you have to remove
Exactly.
all of this. But do it slowly lang.
Okay. Do you recommend, Doc, using your toothbrush to brush your tongue also? Tama ba yun? Or are you contaminating the whole cavity with your bacteria or whatever's in there?
Hindi naman. Yung iba, ginagamit din yung toothbrush nila. Kaya lang pagka ginamit mo yung toothbrush, it doesn't remove all. It doesn't remove mahina. Oh. Hindi niya natatanggal kung ano yung kayang tanggalin nung tongue scraper, tongue cleaner.
Actually po, Doc, no, in our practice, no, very important po yung tongue. We ask our patients to stick the tongue.
Yeah.
Tapos if we see like different colors, like kung may puti, merong something.
Yeah,
No,
that's
kung ibang color, merong something indicative of something. So
That's right.
that's really talagang ginagamit yan sa pag-diagnose ng
Yeah.
certain diseases.
Yes.
No? So magandang po yun, magandang tip yun. So if you see your tongue na puti, lalo in the morning, when you wake up, pag
That's
puti
right.
yung white coated tongue ang tawag namin,
That's right.
ano yan?
It will be an indication of something.
Yes, of something.
Yeah.
So
That's right.
kailangan magpatingin na kayo. No,
Mhm.
pagka gano'n. Okay, Doc? Sige, Doc. Ano pa ho ang ating mga
About the supporting tissues of the teeth, no?
Okay.
Yung ngipin kasi natin, hindi siya directly naka-attach sa bone. So it is suspended by what we call periodontal ligament. Okay, so this periodontal ligament will actually it serves as parang shock absorber ng ngipin.
Okay.
Kaya kahit na kumain tayo ng matigas, oo,
no?
hindi kaagad sumasakit or namamaga because of the periodontal ligament.
Doc, yung mga iba nga dyan, yun ang ginagamit na pang-open ng bottle cap.
Yes, yes.
Pakisabi nga sa mga taong gumagawa yan, I have seen that, no?
Wag
I have
na
seen
wag
that.
niyo pong gagawin, wag niyo pong gagawin 'yon kasi actually hindi lang dun sa hindi lang dun sa pagkabasag ng crown, no, ng ngipin, but also yung trauma that it can create sa loob ng ngipin natin.
Okay.
Ayan.
Sige, Doc, we will discuss more, how to take care of our oral health. With just a few reminders. Diyan lang po kayo, wag po kayong aalis.
Manatiling nakatutok sa DZRJ 8:10 AM, 8 Media at 8 TV, Cable Link Channel 7. This is 8 TV.
Lucky 7 Koi Productions Incorporated, in cooperation with Solera Resort and Casino, present Powerhouse, Pinoy World-Class Performers, spearheaded by former Journey frontman Arnel Pineda, with other performances by Michael Pangilinan as he sings Pare Mahal Mo Raw Ako, and the next big diva, Morissette, with a special participation of UK's X Factor finalist, The Fourth Impact, and Jampinoy Star Quest Grand Champion Mayumi and TOMS Band. Powerhouse, Pinoy World-Class Performers happens on October 28, 2016, 7:30 p.m. at the Theater Soler Resort and Casino. Ticket prices are at 7,000, 5,000, 4,000, 3,000, 2,000, and 1,200 pesos. Tickets are available at Ticket World. For more information, call 891-9999.
Great things often come from humble beginnings. In 1995, Aquabest was established with the simple vision of an Aquabest store in every community. Driven by passion and commitment, and guided by its vision, Aquabest soared to be the leader in its industry. Through the years, many things has changed. New ideas flourished as Aquabest went ahead and forged new ground, reinventing the way we see and experience water through technology. From a single store, Aquabest can now be found everywhere in the country. And now, a new chapter is ready to be written. New communities and trends may come, but in the end, the vision remains the same.
Every single global ill that plagues the earth can be traced back to human overpopulation.
Humanity is the disease. Inferno is the cure.
He created a plague. He left a trail so I can find it.
Inferno is being carried to every corner of the earth.
Florence.
Istanbul.
Venice. There are clues all over the world.
Ang dami ng peke sa world. Pati ba naman puti mo? Peke din? Para totoong puti, mag-Myra Vita White Moisturizer. May vitamin E at natural plant extracts to help nourish skin for that healthy white glow. May double sunscreen na, non-sticky pa. Ito ang totoong healthy white glow. From Myra Vita White Moisturizer. Yan ang alagang holistic.
Trusted quality healthcare. Unilab yan.
This program is brought to you by 8 Media Pro Incorporated. This program is brought to you by 8 Media Pro Incorporated.
Kayo pa rin po ay nakikinig sa ating Klinika On Air na yung Biyernes. No? Kasama niyo po rin ako, si Dr. John Reyes, at ang ating guest po na yon na si Dr. Walter De Rosario. Sa oras na 6:43 p.m. ng gabi, tayo pa rin po ay nagdi-discuss. Doc, sige, let's go back to our discussion kanina. No? So, ano yung mga you were about to say, yung mga periodontal diseases?
Oh yeah, actually gusto kong sabihin kung paano yung supporting tissues of our teeth are affected.
Okay.
Usually ang calcular deposits, ano yan calcular deposits, tartar, calculus, yun. Ito yung nadidinig na natin yan
yung
ganun.
mga tartar na
So
yan.
ito yung mga dumi na nag-accumulate in between ng gums at saka ng ngipin.
So this is basically food.
Yeah, it comes from food.
Food na trap.
Yes, so
Okay.
pagkatapos
Are
hindi
there-
siya natanggal doon.
Are there foods, Doc, na you should be aware of na dapat pag itong kinain ko, dapat I have to brush. Ganyan. Ano yung mga pagkain na yun?
Siyempre matamis.
Ayun,
yung
matamis.
sugar and also yung mga sticky food.
Sticky.
Kasi marami tayong mga kakanin, no? Suman, mga ganyan na matatamis that sticks to our teeth, the surfaces of the teeth. And normally hindi natin nalalaman na meron pa siya doon eh.
Kahit na walang lasa. Wala na yung lasa.
Kahit na wala na yung lasa,
it's there.
nandun pa siya eh.
Yun.
And this one can actually invite bacterial growth with the reaction of saliva and it becomes an acid.
Yeah.
So eto ngayon yung nag-i-start. Now, yung calcular deposits naman, it start as a thin film of bacteria, no? Doon sa in between ng gums at saka ng ngipin.
Okay.
Now, ang mahirap kasi sa dental disease, normally wala talaga asymptomatic eh. Wala talagang mararamdaman.
Hanggat nandun na yung...
Oo. So, pagka walang pain, hindi mo papansinin eh. And then it grows down. It grows down towards the root hanggang sa masira niya na yung bone that supports the teeth. So, ang mangyayari, gagalaw na ngayon yung ngipin. Kasi umuuga na. Kasi wala nang support eh. Wala nang support.
Okay.
So, normally, ang pinaka siguro mapapayo ko, no, sa ating mga kaibigan na nakikinig at nanonood ngayon, is dapat malaman mo kung paano mo i-diagnose yung sarili mo na, oops, may problema pala ako. You know, the first thing, I think, na pwede nilang makita is the bleeding.
Ayun, that's very evident,
Yeah.
no? Makikita ng tao.
Oo.
Okay.
Dr. Jan, merong mga pagkakataon na pagka ikaw nag-brush, no? Pagka nag-brush ka ng ngipin, pagkatapos nilabas mo na yung or dumura ka na sa lababo, makikita mo may bahid ng dugo.
Okay.
Yung idinura mo. Normally yung mga pasyente natatakot sila saan galing ito.
Yeah.
So ibig sabihin pagka merong ganon, tingnan nyo kung saan parte yung or pumunta na kagad sa dentista at magpatingin na kagad.
Okay. Sige daw.
Yun yung maganda.
Yun ang first aid. No?
Yes.
After you see na merong blood, huwag nyo nang hintayin.
Huwag yun ang hintayin. Tsaka kung saan yung dumudugo na yun, ibig sabihin, doon yung may problema. So, ibig sabihin, doon yung merong infection.
Okay.
Kasi ang pagdugo naman, hindi yan dudugo kung hindi yan inflamed.
Yes.
Pero hindi magiging inflamed or hindi mamamagayan kung hindi yan infected.
Okay.
Unless otherwise, nagkaroon ng trauma. Or nabunggo, nasuntok, o nagkaroon ng aksidente, yan, pwedeng mamaga, magdugo. Pero normally, dapat hindi. Kahit na masipilyo mo yung gums mo, dapat hindi dudugo yan. So, ang ibig kong sabihin, pagka ganun ang nangyari, dapat lang natanggalin natin yung cause. Iisa lang ang cause niyan, yung bacterial accumulation dun sa area. So, pagka meron ganun, go to the dentist. The dentist will remove the cause of the disease or the bleeding or the infection, and then everything will go on smoothly.
Okay, Doc. Meron po tayong konting questions, Doc.
Okay.
What is your stand on mouthwash?
Okay, mouthwash.
Can that be a substitute for brushing? Kasi po, yung mga tao, iba, pag nangamadali, sige, just gargle. Tapos na.
Okay. Alam mo, Dr. Jan, nung nasa Saudi Arabia ako, I was part of the study on mouthwashes and also of the they call it miswak.
Okay.
Miswak is what they use in Saudi Arabia.
It's an herb?
It's a stick.
Okay.
It's a stick. Parang kumbaga dito ang counterpart yung sanga ng bayabas.
Okay.
Na binabalatan nila yung dulo, pagkatapos kinakagat nila para maging bristle. Pagkatapos yun ang yun ang ginagamit nila. That's right.
Okay.
That is in Saudi Arabia. In Ethiopia, they have the same. They call it mefakya. But the principle is the same. And we have found out, dun sa study namin, we have found out that it's high in antiseptic content. No, property, yeah. So, kahit na ganun lang ang ginagamit, wala gaanong gum inflammation or gum problem, no? Although sa ibang part ng ngipin, dahil stick 'yon na hindi nila maabot yung mga parts na hindi nila maabot, doon nagkakaroon ng problema. Now, with regards to the mouthwash, no, there are some mouthwashes na nire-recommend kami because these mouthwashes have some hexatidine or chlorhexidine composition that is actually napatunayan na hindi nakaka-grow ang plaque or ang bacteria pag gumamit ka nito. Kaya lang merong mga pagkakataon na nagkakaroon ng pag-dark ang ngipin.
Oh,
it discolors. It discolors the natural teeth. Okay, but the discoloration man can easily be removed by prophylaxis and brushing with professional cleaning. Kaya lang talagang makikita mo yung discoloration. Now, if let's say I will be asked ano ba talaga ang ano?
Okay.
I would say normal saline will still be good.
Good. What is normal saline, Doc? Para sa mga
ito pinaka economical na gamitin.
What is that?
Kumurot ka lang ng 2 o 3 kurot ng asin.
Okay.
Ilagay mo sa 8 ounce na baso ng tubig, medyo maligam-gam lang siya.
Okay.
Tunawin mo yung asin, tapos yun na yung gamitin mong pangmumog. We have to understand that salt is bactericidal. It kills bacteria rather than it only
growth.
Yeah. Okay,
Good,
so
good.
di ba pagka meron tayong mga bagay na gusto nating ma-preserve, lalo na yung isda, we put salt. Yun lang. So, since salt is bactericidal, then salt can be a very good thing to use for mouthwash. Just don't swallow.
Do not swallow, no? And I think do not rub it.
Yeah, of course.
Salt, tapos i-rub nila.
Dahil noon kasi ang ginagawa nila, salt pagkatapos sinasawsaw nila yung toothbrush eh.
Yes.
Pagkatapos ibinabrush nila sa ngipin. Although maganda yung effect ng salt, but then coarse itong mga salt natin eh. Kahit na sabihin mong yung pinong salt.
Table salt.
Still coarse pa rin yun.
Okay, Doc. What about baking soda? Alam ko may mga toothbrush na with baking soda. Can we use just baking soda to clean our
Yes, it is proven that baking soda can actually clean and can whiten the teeth. So if somebody would like to have their teeth a little whiter, then use baking soda.
Paano po ang paggamit? Baka kasi may mga audience na biglang ibabad yung baking soda sa buong buong gabi, no? Paano po ang paggamit? Is it like salt? Just get a pinch or something?
Pwede pong ganon, pero usually pagka ganon ang dapat na ipagamit dun sa patient, pwede natin siyang ihalo sa toothpaste. Yes, para meron man lasa na kaaya-aya, oo.
Yes.
So pwede mong ihalo yung baking soda sa toothpaste. Pagkatapos yun ang gamitin mo as your toothpaste.
Wow.
With baking soda. But there are commercially available paste, I think, with baking soda na.
I've seen this.
There are.
Okay. Sige, Doc. Alam ko, Doc, marami pa tayong kailangan i-discuss na we've only scratched the surface, no? So, kailangan, Doc, meron pa tayo part 2 and part 3 nito, ha? Huwag kayong magsasawa. Huwag kayong magsasawa sa amin. Sige, Doc. I know it's our last 5 to 6 minutes. So, Doc, you have something to say pa before you plug event?
Here's what we can do to help. No, one, don't overdo those between meal streets. No, because between meal streets, these actually are the ones who stays in our teeth.
Ang tawag po dyan, merienda.
Yan, oo. Don't overdo it. I mean,
yung pagmimerienda ninyo.
lahat naman tayo nagmimerienda, pero don't overdo it. And then, second is be sure to brush every after meal if you can, but please brush thoroughly before going to bed. That's right. And then the third, I think you have to learn how to brush properly.
Yes.
Ask your dentist about it. Ask your dentist how you will do the angle, or kasi you have to tilt your brush in order for you to reach areas of your teeth, no? So ask your dentist about it.
Saka I think, Doc, you also have to, yan po ang pong turo ng aking dentist, you have to close your mouth a bit and then para yung toothbrush makaabot doon sa pinakadulo. Kasi kung nakabukas ang bibig niya, hindi niya maaabot yung sa dulo.
Kasi yung cheek natin nakadikit sa
exactly.
Nakadikit sa
Kailangan
sa
medyo ang
That's
bibig
right.
bago kayo
Correct. And fourth, we have to make regular checkups. Make it a habit for you and the whole family to have regular checkups sa dentist. Kahit wala kang nararamdaman.
Kailan po ang regular check-up? Sabi po sa mga viewers natin.
If we can have our checkup at least every 6 months, this will be healthy.
Kahit wala kayong nararamdaman.
Kahit walang nararamdaman.
Walang pamamaga, walang pagdurugo, you have to see your
a dentist. Yeah, you have to see.
Huwag kayong matakot sa inyong dentista.
Kasi hindi natin nakikita ang ating sariling bibig.
Exactly.
Lahat ng surfaces. That's why we use mouth mirrors.
Yes.
Para nang sa ganun masilip
makita
namin yung lahat ng
cranny,
area.
lahat ng part.
That's right.
Hindi nyo alam, meron ng ano.
Opo.
Okay. Naku, ang dahil nating tatalakayin, Doc. Sige po, Doc. I think you have an event. Please invite them po.
Yeah, we have an oral health awareness talks. This will be held on November 12, 2016 at 9 a.m., 6th floor Convention Hall of the Tri-City Medical Center. This is located in Maybunga, Pasig. This is along C. Raimundo Avenue. Okay. So I would like to invite everyone. You can attend. We have some freebies for the first, I think, first 100 guests that will register. For registration, please contact the marketing department at 275-9752, local 305.
Ulit po.
275-9752, local 305.
Ayan. So, para po sa mga gustong magkaroon ng free to. This is a free event.
Yes, and we are going to have also a free checkup.
Ayun.
Yeah, free consultation, free
Ayun.
checkup during the day.
Ayun. So, just register yourself para po kayo ay naka-reserve. At si Doc will be there.
I will be there.
You will be there.
I will talk on some topics actually.
Okay, very good, Doc. Any last words, Doc, before we say goodbye?
I would like to thank you, Dr. John, for inviting me. And rest assured na kung kailangan pa rin akong bumalik, I would be very, very glad, and I will be very happy to come back here and explain and help some more kung kailangan pa.
Okay. Thank you, Doc. Thank you very much. It's our honor po and our pleasure to have you. Baka po meron kayong gustong batiin ang inyong mga
I would like to greet my wife. She's now in Jakarta.
Yeah. Wow, yeah. We are seen in Jakarta, of course.
Yeah.
Hey, ma'am. How are
Hello.
you?
Just take care.
Ayan, ako ha. Sige.
And also my kids. One of my kids is in New Zealand. That's why I think he's watching right now.
Yes. Wow.
Adrian, Katrina, and Kyle. Hi.
Ayan. Sige, Doc. Thank you very much for your time and expertise, Doc, in explaining to us how do we do properly, no, yung oral health. Yun po. So, yun po ang ating pong interview po na yon ay si Dr. Walter De Rosario po ng Philippine Dental Association. May mga konting announcements po ako, no? So, na yun po ay National Mental Health Week, tsaka National Mental Health Month, no? So, yan po ay awareness. This is one of my advocacies po. I am a board member ng Natasha Goldberg Foundation, which is the only foundation for depression, no? So, ngayon po ay National Mental Health Week, no? So, meron po tayong mga activities. Just look it up po sa internet, sa ating Facebook page, tsaka sa ating website ng ngf.com. Ayun po. So, marami din pong ating nakikinig, mga viewers natin. Ayan. I will scroll down. So, sa ating viewers from Japan. Ayan, si Ricky. Thank you for listening and viewing our program. Si Ricky Suzuki from Tokyo. Ayan. Ayan. Tsaka ang ating mga listeners at viewers, itong si Dan Torres, no? At ang aking pamangkin na nanonood daw na siya na yon, no? Hello. Sa ating mga technical crew, marami pong salamat, no? At nag 1 year po ang ating programa at ang ating istasyon ng HI Media. So congratulations po sa HI Media staff and management. Yun po. So it's been 1 hour of a fun-filled and very intense ang ating discussion. Talagang kulang pa ang ating program. Pero Dr. Walter promised us to be back here in a few weeks, no? So yan po. We will look forward to that. Ayan. Sige po, so samahan niyo po ako next week ulit po. Same time, alas 6 po hanggang alas 7 tuwing Biyernes. Ito po si Dr. John Reyes. Nagpapaalam po at nagkasabi ng happy weekend po and stay safe and God bless po sa inyo lahat. Thank you.
Na dapat ninyong malaman, mga kabulukan, pasisingawin at isisiwalat sa Rapid Fire.